Paula spent many years with a mouthful of problems. Will Dr. Meden be able to fix her collapsed bite and give her the confident smile she always wanted? Watch today on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Well, they say life is like a mirror. We get the best results when we smile at it. Well, today on the show, we're talking about a condition that can greatly affect your smile, called a collapsed bite, and all the procedures that go into the dental surgical facelift that is performed to correct a collapsed bite and help proportionately balance your smile. Then we'll have some fun in the kitchen as I test out some home remedies for whitening your teeth. Well, Dr. Meden, our Doctor of Dental Surgery, is back joining us today to help educate us about this condition and show us how this reconstructive surgery happens. Welcome to the show, my friend.
Thank you.
This is a really big show with a lot of work that you've performed on our patient today.
Yeah, we did a lot of work.
Okay, we're talking about a collapsed bite to begin with. What's a collapsed bite?
Well, a collapsed bite is when the upper and lower jaws actually they're meeting, and they are meeting in a collapse situation, and therefore overlapping each other. Sometimes, most of the times that we see is by severe wear of the upper and lower dentition. So there's severe wear that people are bruxers, and throughout years and years of wearing their teeth, and then nobody really brought that up to them. Either they did or they didn't, and they continued that, so then it has a severe collapse.
You said something very interesting just a moment ago about bruxism.
Yeah, bruxism.
What is it?
They're called so-called bruxers, people that they grind the upper and lower jaws, and they actually grind just like, you grind something, and
Yes.
their teeth look like somebody took a
So they're like little,
saw
I was going to
and
say like
cut 'em
little
off.
stumps.
Correct.
Okay, but then how does that cause a collapsed bite?
When the measurement that we have, or the distance that we have from the upper and lower jaws, okay, is reduced by the excessive wear of these teeth, then the upper and lower jaws get any collapse formation or form. So then the joint here starts getting affected by that.
So I'm listening to you, so you have now incorporated other issues on the facial structure that is caused by having a collapsed bite. So does the bottom half of your jaw drop?
No, they actually, because of the muscles of mastications that we have
Yes.
on the side of the face, remember they are pulling as we chewing. It's a chewing motion that we have. So
Yes.
they extend and they contract, they extend, contract. So what happens is that when there's severe wear, they contract. So then the lower jaw goes up.
Oh.
And so then now this area right here, it shows, usually you see it more in a physical way of their face, the structure way. The cheek becomes collapsed.
Of
Means
course.
like kind of
Yeah.
crunches down.
Mm-hmm.
The person usually becomes, it looks older, a lot older, just because you don't really see much teeth in there.
Yes.
And then because the distance has been severely shortened.
And does the bottom of your jaw drop and come forward because you're grinding too much?
No, most of the times
Okay.
that we see is the jaw, actually the upper jaw goes over the lower jaw.
Oh, so it's like
the
an
lower
overbite.
Correct, but is so severe that actually the teeth sometimes start touching the upper gum area.
Okay, so we've talked a little bit about a collapsed bite. You're also doing a smile lift. What do you call a smile lift?
Well, a smile lift is where we're giving the person an ideal length of the teeth. So it goes in conjunction in a situation with where we have a patient that she has a collapsed bite.
Yes.
So then we give her a smile lift, where we give her the actual measurement, put it back in where she was maybe when she was a teenager, and she had that distance that she had for the upper lower jaws.
Well, how is that done?
It's done with, you got to have a total mouth rehab, which it means all the teeth had to be worked on. Or in this case of this patient, she was missing some teeth, so we had to actually use a lot of implants to get it to that
Wow.
situation.
This is
So
a big job.
she had a really comprehensive case where she had surgery. First of all, we didn't have enough bone on her to actually place these implants, so we had to have some bone augmentation, with membranes. So I increase her bone length and her bone structure, so I could place these implants, into her jaw, and then an upper jaw, and then they'll be able to actually complete the rehabilitation.
So we had several things. We had a collapsed bite, we needed a smile lift, we didn't have enough bone in the jaw to put the implants on, so you had to create bone.
Correct.
Okay, and you say with membranes.
Yeah, we place usually when
membranes?
bone and membranes go kind of together. Usually when we want to place bone in areas that we need to augment, we usually drape him with a membrane.
Dr. Meden, it sounds like a big job.
Yeah,
I'm glad it was you and not me. But then who knows what a teeth would look like if I did it. Well, I'm a bit of a teeth whitener at home, and I wanted to come up with your own teeth whitening systems that I found in a magazine, and they say they're the top 3 remedies. We'll be in the kitchen after the break so I can try them out and see if I can get Dr. Meden to try them with me. We'll be right back. Well, we're back, and Dr. Meden and I have decided to show you some methods for whitening your teeth using basic ingredients from your kitchen cupboard. Are you ready?
Yep,
all right, so the first one is baking soda and lemon juice. All right, so this, I want you to try this one yourself. So what we do is we put several teaspoons of baking soda and enough fresh lemon juice or water. Now, we've used the fresh lemon juice, so I want you to try that instead of water. Okay, so what we do is we tip this in here. Oh, I don't think that was meant to happen like that. Is it?
That's all the baking soda.
Well, is that what it does?
Yeah.
Okay, well, how do you make your teeth white? Oh my God. I would assume you spin that around. What does it say? It says wipe your teeth and any extra saliva. Oh.
You expect me to put this in my mouth?
Yeah.
Oh
They
my
say.
God. Let's try it. Oh, it's pretty sour. Wow.
That is the #1 at-home teeth whitening service. Did you know that? From the kitchen cupboard. Well, we're going to also now try the strawberry salt and baking soda scrub. And what you need to do now is we're going to mash up, okay, some strawberries into a little bowl. All right. Now we also put a pinch of sea salt in there. All right. I'm not quite sure why that says about this. Okay, now a little bit of salt, hold on. Okay, now what do you do next? Wipe any it says saliva again. Mash the berries into a pulp and a pinch of sea salt and half a teaspoon of baking soda. If you're using... I've already put some of that in there. You ready?
Oh my goodness.
I know, I don't... It's pretty disgusting, everyone.
Let's try this.
I'll Okay, coconut oil. Do you know about that? Before you brush your teeth, scoop 1 tablespoon or a little less, depending on the size of your mouth. Have you got a big or a small mouth?
Quite a lot there.
Well, that's a teaspoon of coconut oil. You can either use it to soften, you can either soften it or just put it in your mouth. Apparently, you're supposed... Oh, I can't do it.
Yeah, is it true?
I can't. I put coconut...
That's a lot of coconut oil.
Oh no, I'll be sick. I can't. Just let me taste it. Dr. Meden, of course we have the professional products that we can get from you and take home and use. Tell me a little bit about the Zoom. Give me your best 3 points of why we use it.
Zoom has the in-office products, and also they have the take-home products, which is they have a day white and night white, and they actually whiten the teeth pretty fast, within about 25 minutes.
Does it have a flavour?
Yeah, they come with some flavors.
Okay, is there an aftertaste?
Usually you get just right after you do it, very little, but then that's going to, it won't last.
Sensitive on the teeth?
Sensitivity, some patients may be sensitive to it. This product has actually a relief that you actually place in the tray, and once you place that, it desensitizes the teeth.
Okay.
So you use it in between bleaches.
Perfect, love that. And our other product that we're just about to launch as well.
There's a product that just isn't in market now, it just came out. It's called the Zoom Pro.
Yes.
Quick Pro, the Zoom Quick Pro. What it is actually a 5-minute whitening. It's done in office, and just when you have your cleaning, after the cleaning, they apply this gel on your teeth, and it stays there just for 5 minutes. Then they place a sealer
Okay.
And then the patient, after half an hour after they leave the office, then they brush their teeth and they brush that stuff
Okay.
out of the mouth.
Well, I'm glad you were my guinea pig and we've made a complete mess of the kitchen, but thank you very much. Anyway, Dr. Meden, let's head over to our patient, Paula, and get a little insight on why she's getting a smile lift.
I'm Paula Duncan, and I live in Sandy, and I'm 70 years old, and in the past, another dentist really messed up my bite, so I got excited about getting it fixed finally.
Okay, welcome Paula. Welcome back to my office, and I guess it's going to be a step 2 of your great transformation of your smile and actually your bite that we actually trying to reestablish.
Well, I'd had my teeth straightened, and so they were very worn because they were so crooked, you know. Some of them were almost 45-degree angle, so they needed to be crowned. So I just checked with a few dentists, and I should have gone into it more because he kept my lower teeth way back, and then the upper ones went clear down to my gums, so you look like a person, like Dr. Meden said, who takes their false teeth out and your gums go together, or your mouth or face kind of collapses. I just am so glad that I'm doing it. That's more important to me than the appearance, but the appearance is exciting, fun.
Don't go away. When we come back, we'll get to see Dr. Meden in action as he performs this procedure and gives Paula a brand new smile. Closed captioning for the younger you is brought to you by Mindful Medical. It's time for Paula to go into surgery and come out with a balanced smile and a brighter and more youthful appearance.
So as you know, we have established the back teeth, and then we have get good occlusion on your teeth and open the bite. And are you feeling comfortable?
Yes,
Okay.
feels great.
Okay, that's great. Okay, so as you see in the screen there, that your bite was totally collapsed, and now we have opened somewhat to a good measurement and get your bite totally reestablished. So now the next step that we're doing today, that's why you're in my office today, we're going to restore the front teeth.
So I'd always hated them, but I didn't want to spend the money, and the previous 5 years I have been caretaker for my husband, so I just didn't think about it. I just pretended it was okay.
As we see that today, the work that we perform in Paula, she had, just to review it, she was presented to me with a collapsed bite. So totally collapsed. We have a measurement that we take initially, and she was really in a collapse mode. Means that the upper and lower jaws, they met totally in a collapse form.
In January, 2 of my front teeth just broke off after I got home from the Midwest, my father's funeral. So I researched and looked at all the ads and everything, and came in and talked to Dr. Meden about implants and replacing those teeth. Well, then when he saw how bad the bite was, he said, you know, would you like to fix that?
She has gone through some period of time using something that is called orthotics. Orthotics, what they do is they just create the bite that we initially establish and see how comfortable she feels with all this bite, with the new bite. So therefore, we won't create any problems with her temporomandibular joint in both sides. So she's been comfortable going through all day. We increased the bite just slightly during some previous visits to see how comfortable she felt on all these procedures.
I've always been a little self-conscious about, I never like any of my pictures, so, and then when you get older, you don't even worry about your appearance as much either. Like, go all week. I'm a landscaper. I plant flowers and don't put on any makeup at all. So, you know, that's one thing about getting older.
And once we established the bite that we needed, the measurement that we actually need to, then we finalized the posterior teeth, the ones in the back. One of the procedures that we were performing today was reestablishing her anterior bite, which is the front bite. So therefore we prepped the teeth. Now the teeth that a previous dentist that had worked with her before, or on her, they prepare these crowns and they prepare them quite short, obviously, you know, from her previous bite. And the other thing that they performed was that since to accommodate those teeth, they took the teeth and they tilt them toward the inside her mouth. We call that toward a lingual area. Therefore giving her short teeth and kind of in an awkward angle.
I started researching because I wanted a younger dentist with all the latest equipment and all that extra training so that it would look right and last the rest of my life.
This, we're going to remove a lot of the stain that she has there once we place the implants on this area right here, because this is where the implants are going to go. It's going to go one there, one right here, and we're going to restore all this area.
Well, I just want to stay healthy. There's a lot of longevity in my family, and I plan to stay fit and be at least 100 years old.
These teeth right here, see the length of them? They're going to change. They look a little too long, so what we'll do is we'll adjust the height with the way they bite down, so we'll be able to adjust. So this is not the way the final.
So I have this big kind of lisp to my speech, and on top the front six are the temporary crowns.
Now she's ready to actually have those, placement of those implants, and also not only the placement, but actually restore those implants.
I'm just excited, that it'll be done and how well it looks better already. And all my friends say so too, so, and it just feels better because you just bite down and everything's fine.
After the commercial, I get to sit down in the studio with Paula and Dr. Meden to take a look at the final results, and I want to see if Paula's really happy with them. Well, we're back at one of the best parts of the show where we get to see the before and after shots. Paula, are you ready to see your before shots again?
You bet.
Oh my gosh. Now, of course I can see them in the studio, but when I see them side by side, it's a completely different Paula. What happened? Where did the old Paula go? To Dr. Meden's office?
Transformed my ruined mouth.
Okay, you told me your age, and I want to say that you're 70, okay? Why did it take so long for you to do something about your teeth?
Probably financially worrying,
Okay.
and then time-wise. I was taking care of my husband,
Yeah.
and so that was all I could involve myself in at the time.
Okay, Dr. Meden, an incredible journey that you've done here. Because when we were talking about it earlier on in the show, and you were saying it was a big job, the producers had told me, Troy, this is a big case that we're taking on. I had no idea of how much work was getting done. How do you feel about the results?
Well, I feel great about the results, as you can see. And she is being really, despite, like you say, her age, with all the work that we did on her, Just got to remember, she was missing a lot of bone and the
Yeah.
areas in the front, like you saw in the camera, and then we had to augment those areas. Then we had to actually place bone grafting and place implants, restore teeth, increase her bite. Her bite at her age is amazing that she had transition, as you said. We placed on orthotic devices on her so we could increase the bite without affecting her joint. So then, therefore, I used to just be in constant check on her constantly and to see how she was doing with this transition of the distance between the upper and lower jaws.
So from start to beginning, how long did this process take? Several months, I would assume.
Yeah, it has taken close about 10 months.
When I see you smile now, I don't know what you were like before this. Did you used to walk around with a big smile, or you're just beaming?
More so now, because it's embarrassing to have that collapsed face.
How long in your life did they look like that before you had this done?
Oh, maybe 15 or 20 years.
Wow. So you were walking around a long time with a very little smile. Were you covering up your face, or?
No, I didn't have my front teeth missing, so it didn't look nearly as bad as right before I had all the work done.
You basically reassessed the whole procedure.
All procedure.
So we went in for one thing and then started digging, and we were like, oh, there's a lot more going on here that we need to look at.
Okay. She came first to me not to actually restore 2 teeth. That's what she actually came for. But then I started looking at her mouth, and I said to her, has anybody mentioned to you that you have really a severe collapsed bite? And one of the things that really amazes me is that she had a full mouth of crowns. Wow. So some dentist did a full mouth of crowns on her, though never advising her that she should actually have a total mouth rehab with opening the bite. So he did these little tiny crowns all over her mouth. So not increasing the length of those teeth the way that she deserves to have.
That's a very interesting point that you were bringing up just then, because when you don't have all your teeth, it does make you look older from the outside, not necessarily the smile, but the lack of teeth that supports the face.
Correct. It's just like in the old movies, you've probably seen it, that an old man or an old woman removes the dentures and closes the mouth and have it total
So did my grandmother.
So it's almost that situation.
But she did it to scare me. You know, because I used to, as a little kid, unzip her little dress, and she'd put her teeth in her bra. So we would we would run around the house screaming because it was the most frightening thing we'd ever seen.
She was playing monster.
Yes. Is that what you call it? She was a monster, let me tell you. No, she wasn't. Do you feel younger?
Sure,
Do you feel you look younger?
yes,
I think you do too. I think you look stunning.
thank you.
Good job. They're going to be around for a long time, those teeth. They're so pearly white.
Right.
They're beautiful. Well, congratulations. Thank you so much for Dr. Meden for doing an amazing job. Well, if you're one of those people that has a problem with grinding your teeth, or you've had a tooth loss or gum disease that has left you with a deteriorated smile, then maybe a dental surgical facelift is just what you need to regain your youthful smile, because nobody's ever seen a smiling face that was not beautiful. For more information about Dr. Meden at Elite Smiles or the show, make sure you head over to theyounger.you.tv, and I'll see you next week. Find out next week how Dr. Red and the team at Red River Health and Wellness can help someone suffering from Hashimoto's disease. Okay, first thing, what is low thyroid?
Okay, this is when your thyroid is not producing the proper life-sustaining thyroid hormones that your body needs.
The Younger You set provided by Madison McCord Interiors.